Now, I've already talked about Sajid Javid in the stream and how much I absolutely despise this man for being an objectivist and think that everything has to have a monetary value attached to it and we should marketize everything. And of course, having said really ridiculous stuff about poor people not being MPs yesterday, today he was on Times Radio talking about fundamentally overhauling the NHS, which of course means, I'm assuming, privatization. But I'm going to have a react to what he said, and we're going to see just how ghoulish his recommendations for the NHS are.
I know that your fundamental point within this piece is that you want a royal commission to report on the NHS within a year of the next election. And that also depoliticises it because, as we find on this programme, the minute you talk about this, people adopt fixed positions. But what kind of things might actually move the dial here and kind of propel the NHS into the future, a future where it can actually cope?
Yeah, look, thank you. And there's a lot to celebrate about the NHS over the last 75 years, and it's really good to mark that during this week. But I think when we all look at the NHS today, and especially when we think about health outcomes, I think we have to be honest and compare it to other similar countries and say we've got to have better health outcomes. And you're right.
Yeah, these countries spend more per capita than we do, right? People say, oh, compare it to Switzerland, compare it to Germany. Their healthcare spending per capita is higher than us, right? Imagine if we matched their healthcare spending per capita, or as a percentage of GDP. Imagine how much better healthcare outcomes that we would have gotten if we'd bothered investing in this stuff, or didn't bother spending loads of money subcontracting things out to Serco, or to G4S, or to Centene, or to Virgin Care, hiring agency nurses, for example. Just a thought, maybe.
Whenever this whole issue is discussed in Parliament by politicians, it turns into political football. It's a very sort of toxified debate. There's what I'd say for politicians. There's almost they sort of lean into this narrative of adulation because that's what they think what people want to hear, without actually working out how can we get better health outcomes. And your question about what needs to happen, I think a good starting point would be to look at other countries. You know, when you
Yeah, MCH, Sajid is like a hardcore objectivist, right? His fundamental beliefs, things like greed is good, everything should be marketized, the price of everything, the value of nothing. He's a proper ghoul, right? An absolute demon.
You look at other similar-sized countries that all have universal healthcare systems, be it Australia or Germany or France or Denmark and these places. Comparable countries in many ways. All rich countries, all spending a lot of money on healthcare. We, by the way, are one of the highest spenders in the world on healthcare. I think 6 out of 33 of the world's richest countries. We've got.
But you literally talked about countries just before then who spend more than we do.
To work out why they're getting better outcomes. How are their models different from ours? Why are people not waiting as long? Why are outcomes in cancer or cardiovascular disease generally better than what we're seeing in the UK? And I don't think we've got enough time to go through all that now.
No, but
that's why you need a royal commission.
Well, absolutely, Sajid Javid. But as a former health secretary, I bet you've looked at those exact systems and you've already worked out why they're getting better outcomes. So give us a clue.
I'll give you a couple of ideas. I think that their approach to prevention. So the NHS is very much, think of it as a national hospital service. It looks after you when you've become ill, and often really ill. And
is this me, or does this sound exactly like Wes Streeting? It's very similar to the same kind of rhetoric that we're getting from Wes Streeting. Ironically, I don't think it's unreasonable to say that we need to be talking about how we make sure people don't get to hospital in the first place rather than picking up the pieces. Unfortunately, Sajid, that would have required literally any public investment from the government into social programs from 2010 until the date of recording, which of course the Conservative government hasn't done because it doesn't believe in these things. And I know you don't believe in these things either because you're an objectivist and you think everything should be marketized, right? And the state should be as small as possible. And a lot of the healthcare problems that we have in this country are a result of a lack of government oversight, a lack of regulation, a lack of social safety net for people to be able to consume in a healthy manner, a lack of any kind of structure in place to keep our society healthy from the government down. You rather than just expecting, it's just a problem with individual responsibility, etc., which of course can never be affected by any systemic issues in this country, such as, I don't know, widespread poverty, the gap between the rich and the poor, the compression of wages, all of which, whilst on top of failures to invest in the NHS previously, have caused knock-on effects that leave us with higher bills now.
And so there's a lot more that can be done as a country on trying to prevent that in the first place, or to slow it down. We know what the biggest killers are out there. It's obesity, it's smoking, it's alcohol, it's drug addictions. And other countries have a much more broader, joined up approach to prevention. Mm-hmm. Another area is models of care. The other countries I mentioned earlier, they have different models. Some countries like Germany would have a social insurance model, some have a contributory model, some like Denmark has this model of fewer but larger so-called mega hospitals as a model.
I think it's these social insurance models and things like that. Fundamentally, what he means is make poor people pay more for healthcare. That's all he's speaking about here. He's talking about making poor people pay more because he doesn't want rich people to have a higher burden on healthcare payments because they have higher taxes. It's as simple as that. That's the only reason why he supports this.
I'm not sitting here today saying each one of those is necessarily the answer for us, but we do need to look at why other countries are using different models and the outcomes that brings. And the last thing, if you want another example, is digital. A lot of the other countries, or all the other countries I've mentioned, they've embraced digital and innovation much more quickly, and they adapt new technology much more quickly.
Maybe we might have done this, Sajid, as an ex-health minister. Maybe we could have done this if you'd bothered investing in the NHS at all, as far as infrastructure is concerned. But of course, no, we were too busy socially our own population. But we've been working on the same antiquated systems forever because you refused to invest and you sold it off to private companies who had no reason to invest.
The NHS still has something like 600 fax machines. There's 80,000 doctors or nurses using pagers. I mean, there's some hospitals that are still entirely paper-based. And I think you'd be hard pushed to find that anywhere else in a comparable country in Europe. And by the way, it's not a question of money. We are, as I said, we are spending more than most rich countries as a proportion of our GDP. And
except not Germany, the social insurance model, who you literally talked about already not 3 minutes ago.
Already, the NHS is something like 44% of entire government day-to-day spending. 44%.
Okay.
And you could put more money in, but you will not solve these problems.
Okay, I think you previously used...
But you can put more money in to be able to alleviate the problems if you spend it in the right way. And of course, as Deletion Quarter points out in chat, we are pissing away tens of £1 million, giving out private contracts to mates of the Conservative Party, Capital Liaison, Serco, G4S, Centene, Virgin Care, etc., which you didn't need to do. That money could have been spent on proper wages for our staff, proper investment in new technology, proper revamping of our system. But of course, right, that doesn't buy you donors that puts you in government, Sajid, does it? No.
Used to be charged for GP appointments and A&E visits. Would that be part of the future?
Well, look, I think what I want is for a Royal Commission, which is, by the way, is a body of experts and taking a cross-party approach, trying to take a dispassionate look at this issue. I'd want it to sort of come up with ideas. But you are right in that, if you ask me about me personally, and what I actually want to see to make it clear is a Royal Commission look at the evidence and make a proper assessment. Is that it is noticeable that in other countries that have universal healthcare systems that share our value, which is that everyone, regardless of means, should get the healthcare that they need, something I believe in passionately, but in those countries, in most other countries, for those that can afford it, they are asked to make a contribution, and that does provide an alternative source.
We all provide a contribution. They're called taxes, Sajid, right? It's all going into the same pot in the same way if we had a social insurance model. There's no fundamental difference to either of these things, really and truly. But with general taxation, the burden predominantly falls upon the rich. Under a social insurance model, people's contributions are far less pegged to the amount that they can actually spend because, their payments are far less stratified by wealth. It's as simple as that.
Income that isn't the general taxpayer.
Okay.
And I think that it's important to look at that as well.
Okay, we spoke to Johnny Mercer, the Veterans Minister, who says that he doesn't agree that privately Conservatives say that the NHS is unsustainable. He doesn't think a Royal Commission is the answer either. Why do you think a Royal Commission is the answer? Because governments often ignore their findings.
Because I think that it's clear that when the NHS is discussed in Westminster, that it does very quickly turn into this political football. I mean, that is obvious for anyone to see, and it stifles any serious conversation about its future and about how to make improvements. And
No, because we don't want you to change the model. The public doesn't want it to change. We like it how it is. We didn't want the Lansley reforms. We didn't want austerity to take money out of it. We didn't want it to become this subcontractor hellscape of shat away money into the pockets of billionaires. None of us wanted this. None of us support this. Every poll shows that people want it to be paid for by general taxation provided free at the point of use and owned by the government. Everybody wants this. It's only headbangers like you who want to change that, Sajid.
And in our country, in the past, when we've been in that kind of situation, something that is so important as this clearly is, that the whole purpose of Royal Commissions is that it is to have this sort of body that is taken away from day-to-day politics to report back. And ultimately, remember, whatever the Royal Commission comes up with, it's for the government of the day to decide. That's the democratic and the right approach. No. It's for the government of the day to pitch it to the voter base in their manifesto at the election, right? That's it. The Health and Social Care Act was passed by a coalition government where you barely even had 30% of the vote in the country. I don't think that's a mandate for ripping up our healthcare service with reforms that your own party now says were shit and didn't work. And other than that, I certainly can't think of another way to look at the NHS for the long term and make sure it's fit for the next 75 years.
Okay. I am really interested in, and I thought it was very striking that you said that privately Labour and the Conservatives concede that the NHS is unsustainable as it is currently run. And we've spoken to people on both sides today.
The Labour side, who believes that it's unsustainable, are all like Wes Streeting, as we've already pointed out today, both in chat and from myself. Like, how different is Sajid Javid to what Wes Streeting is saying? Deletion Quarter in chat rightly points out right now, Wes Streeting keeps saying free at the point of use. Neither of what these people are saying, right? Obviously, Sajid Javid is open with it. Wes Streeting is keeping his cards close to his chest. Neither of this precludes the idea of a social insurance system, because at least it's still free at the point of use, right? Even though you're paying it through your mandatory insurance contributions. God save us from insurance systems, which is rationing by any other name. Very, very true.
And they both said that's not true. But maybe that goes to the point. That's just the point that you've made.
That's the point I'm making. That's exactly what you'll get today, right? You'll get any.
So are they fibbing? Are they fibbing, Sajid Javid?
Well, they're saying what they think the people want to hear, right? What they're saying, as I told you.
They are saying what people want to hear, because people all fucking disagree with you. We all want the NHS to remain in the same model that it is. In fact, go back to the model that it used to be, rather than this open season for private contractors.
The narrative of adulation, and they think that people just want to hear that everything's great, don't worry about it, isn't it all brilliant? When the reality is, what matters, I think, to people are health outcomes. What they want to be is they want to be healthier, and they want to live longer, and therefore they want the best health treatment. In an age where the burden of diseases change, aging, society is aging. You know, when the NHS was created, there were 500,000 people over the age of 80. Today, there's over 3 million, and that number is rising rapidly. There's new drugs and new treatments that we rightly would expect. And we've got to have a system that can make sure people can get those drugs and new treatments. And so, you will get, I guarantee you get, most politicians on today, and they'll just say the same thing. They pretend everything's fine, especially over the next few days.
The thing is, we understand that everything's not fine, right? I'm not saying that everything's fine. There is clearly an NHS crisis, right? What we disagree with, Sajid, what we disagree with fundamentally is where this crisis is coming from. And do you think, because you're an objectivist, You just fundamentally cannot accept that you are at fault. First of all, because it's against your ideology, and B, because then people would have to blame you for these problems, and not indeed the model of the NHS, which is what you want to be able to blame. If you enjoyed this video, please do consider liking and subscribing. It does help out the channel and the algorithm. And if you click the bell notification icon, it will let you know when I go live and when I upload videos. If you'd like to follow me on social media, my handle is @NoJusticeMTG, and that is Twitter, TikTok, Facebook, Instagram, Twitch, and YouTube. If you want to support my channel in a more financial manner, you can do so by becoming a member for just 99p, by super chatting, or by supporting me on Patreon, with the link is in the description of this video, and hopefully I'll catch you on the next segment.